Viral versus bacterial infections. What's the difference? Today will be a little explanation on the topic of viral or bacterial infection in humans. I regularly encounter situations where people do not understand whether they have a bacterial or viral infection, drink antibiotics, prescribe them to themselves, get a lot of consequences and extremely undesirable health effects. Therefore, let us understand how to distinguish between viral and bacterial infections. Remember, antibiotics are prescribed only by a doctor. Let's start with the symptoms, because this is what you will encounter first of all, and even by symptoms, you can assume what kind of infection you have. A viral infection usually starts simply, meaning that yesterday you were still feeling healthy. Maybe your throat tickled at most, and today you are bedridden. You can't get up because you feel so weak. Symptoms of viral infection often cause systemic symptoms like fever, body aches, and fatigue. Symptoms usually develop quickly and last for a short duration. Also, viral infection most often aches muscles, bones, that the whole body aches, plus it may also hurt the eyes. The temperature in a viral infection is 38.5 degrees, or 39 degrees, or even higher. The viral infection passes, somewhere in 4 or 5 days, and usually there is no need to drink antibiotics, unless prescribed by doctor. Generally, there's no specific cure. Treatments focus on relieving symptoms while the immune system fights off the infection. Antiviral medications can help in some cases. Recommended to have a bed rest, plenty of water, food containing proteins and fresh air. Well and maximum symptomatic treatment, which of course people do not like. Most of the people wants a magic pill. Antiviral medications can help in some cases, and bacterial infections usually tend to start gradually, usually first in the throat. Then you feel the tonsils enlarging, and then you have, for example, a sore throat. And you can say that as you were normal yesterday or the day before yesterday, and today you feel very bad. Symptoms of bacterial infection can cause localized symptoms like pain, swelling, and redness. Symptoms may develop more gradually and persist longer if untreated. Headaches in bacterial infection are common. Pain in the throat or pain in the face area of the sinuses, for example, or the teeth can hurt, which can also mislead a person. If you visit the dentist, he or she will say that your teeth are healthy. It was a sign of sinusitis or maxillary sinusitis. The temperature in a bacterial infection usually is around 37, 37.5, or up to 38 degrees. Bacterial infection lasts longer, about 7 days. It can be longer in case if a viral infection is joined by additional bacterial infection. That may increase period of illness. Can be treated with antibiotics, which kill or inhibit the growth of bacteria. It's crucial to complete the prescribed course to prevent resistance. Antibiotics can be prescribed by a doctor. Do not take them on your own. For example, look at the color of the nasal discharge. If the sputum, nasal discharge, or snot is clear, it is most likely a viral infection. If it is yellow-green or any other color, it is more likely to be a bacterial infection. Well, the clinical picture is not always a reliable indicator of what kind of infection you have, because nowadays infections can have a blurred clinical picture. One infection can be associated with another infection. A mixed infection can be associated with a virus, a bacterial infection, and so on. So it is more reliable to do a general blood test. What do we look at in a blood test? The first thing is the white blood cells, WBC. In a viral infection, they can be normal or even decreased, but in a bacterial infections, they are usually elevated. The second thing is the lymphocytes. Lymphocytes will be the opposite, elevated in viral infections and decreased or normal in bacterial infections. The third is the erythrocyte sedimentation rate. In a viral infection, it will be normal. In a bacterial infection, it will usually be elevated. The fourth thing is the neutrophils. They are considered in the unfolded leukocyte formula, and in the case of viral infection, their number does not change, but in the case of bacterial infection, their number is increased. This is the basic minimum you need to know to find out what kind of infection you have, so that you do not take unnecessary pills and do not harm your own microflora. Save this video, share it with your friends, and be more aware of your health.